Thank you. Can you hear me? Since we were having trouble hearing before, am I heard?
Yes, we just had to do a little modification here. You're being heard.
Okay, so yeah, so I'm seeing several things on my screen. I have it on speaker, but I'm seeing, seems like, let me put on gallery. All right, hi, everybody. Yeah, so I just want to say this is such an honor for me, and wow, so I'm here really representing Core Energetics and John Pierrakos, and that's what I'm going to try and talk about is Reich's influence on Pierrakos, because I think it was the biggest influence in his life, to be honest with you. So I'm going to share my screen, and supposedly, according to David, this will work. So let's see if it does.
It works.
It works. Yay. Okay, there you go. All right. So now everyone's pictures are in the way. Okay. So yeah. So the man who introduced John Pierrakos to the life energy, that's basically what I want to say. So Reich's contributions to Core Energetics, to choose truth over suppression, to allow and enjoy sexual energy, to choose pleasure over pain, to feel whole within ourselves, to live fully each day. And John said, Reich's was a positive philosophy of life. And he also said, nothing changes until the body is more integrated and the body vibrates. And I think that's really true. So, okay, so I think Pierrakos had a journey from orgonomy to bioenergetics to core energetics. Let me just ask, am I being heard all right? Because I hear a little echo, but okay, so good. So interestingly, this picture to me, I don't know if you can see it. Oh, sorry. It says it all. Here's a person standing and here's a person lying on a mattress. And when John got together with Al Lowen, they stood people up. So there's something in that picture that talks to me about the journey in his work. So John Pierrakos tells this story, and I don't know if it's true, and many of you may know more than I do. So you can fill me in later on what the truth is. But John said that he met Al Lowen when he went to rent office space in Greenwich Village after he had moved to New York from Greece. And he rented a space from Al Lowen. And then, surprisingly, or maybe not surprisingly, they both found out they were patients of Wilhelm Reich. So in seeing Reich and renting space together, they developed their own form of Reichian therapy, which they called bioenergetics. And they, again, I'm going by the stories I've heard. I don't know what's exactly the truth. But the changes they made were what I just said, to stand people up, because they felt by laying on a mat in the entire process, that there was a lot of regression going on, and they wanted their patients to start taking responsibility for their own life. Stand on your own 2 feet, take responsibility. And another difference concerned the segments, because from what I understand, Reich always said you leave the pelvis for last, always leave the pelvis for last. And in standing people up, they had to work with the legs first in a certain sense and establish grounding. So they were no longer working sequentially. So that seems to be a difference. So there's less rigidity in how you work with the segments in core energetics, I believe, than in a traditional Reichian therapy. Well, eventually, and again, this is where I'd like to have you tell me the story, Al and John split, presumably over the issue of spirituality. John got involved with the Pathwork community, which was a spiritual community led by Eva Brock, who channeled something called the Guide. And they fell in love in addition to everything else, and later married. And she became Eva Pierrakos. But in the meantime, from a psychological level, he wanted to integrate the pathwork, some of this pathwork spirituality into bioenergetics. And Lowen, although Lowen is not anti-spiritual, but at the time Lowen was against that. That's how the story is told. And so that John left. Meanwhile, he kept a beautiful file of all the letters that people wrote to him at the time he and Lowen split. One of them is actually from Lowen. And they're in, the letters are interesting. People just mostly supporting him because of, understanding where he stood. And Lowen saying that, their friendship would last no matter what. I think David Boadella wanted to publish some of this stuff. I don't know that he ever got permission. And so different people wrote letters. These are just a few of the people that wrote letters at the time. So then the next step for John was to develop something called the Institute for the New Age of Man, which eventually became core energetics. And he had this idea of the individual having an evolutionary task to fulfill on this planet. I'm not sure we're doing it, but that was the idea. So for him, the core, and he used core differently than Reich does, and I'll say something about that a little later, but for him, the core, well, maybe it's not as different as Reich does, which is also interesting, but for him, the core is the higher self. And so I think this whole process for him was to emphasize being in our higher selves and finding our life path. He also wanted to change the nature of the doctor-patient relationship. So Reich had tremendous influence on John Pierrakos. And when John was a boy of 15 in Greece, he actually saw a picture of Reich on a book about life energy. And he said, when he saw this book, wow, I really want to meet this man. And then, as any other kid would, he forgot about it. When he came in 1940 to finish medical school in the United States, and, he began to work with Reich, as I mentioned earlier, and he was Reich's patient. He had no idea that this was the same man. So here's synchronicity in action, if we want to bring Jung into this picture. And he says, only after working with him, meaning Reich, for 8 years, did I finally realize this is the man I was looking for. It was quite crazy. And then later, John wrote in something else that doesn't have a date, I was Wilhelm Reich's patient. Reich and his work were my teachers, but I betrayed him. And when he says that, he's referring to the fact that when Reich went to jail, he didn't support him at that time. And I think he forever felt really terrible about that. but then he says, I never betrayed his work. And I think you'll see that in Kornergetics. Through him, I gained my greater vista of life. After studying Reich's work on orgone accumulators, I became fascinated by the life energy. It is my dream to give him, meaning Reich, to all of you. I pay homage to Reich. And then I'll introduce myself again, how I met John Pierrakos, MD. So I had been studying nonverbal communications at the University of Pennsylvania with Ray Birdwhistle, who's an anthropologist who some of you may know or have known of. And a colleague of mine who actually I think is or was at this conference this week, Michael Broder, and we were both living in Philadelphia at the time and good friends. He said to me, you know, you've got to go see Pierrakos, because he knew of my interest in nonverbal communications. So John was at a humanistic psychology conference. This was like in 1982 or something. And I went, and I was sitting in the audience, and I was totally mesmerized. I'd never seen a body reading. I'd never seen anything like this. You know, people came up and he could just, you know, and he could just tell them their life history. He didn't know these people. So afterwards I went up to him and I asked him if I could study with him, because I wanted to know how to do this. And so a year or so later, you know, I began my work with him. I actually trained in Kornergetics and eventually became my supervisor, my mentor. And I worked closely with him as we established training in different countries and so forth. It was a very amazing, exciting time for me. And he said later that on our first meeting, he knew, because he was a little psychic, that we would have a close, long, and important relationship. I didn't know that at the time, though. But I've always been fascinated with body readings, and I still give courses on them. I love them. So talking about the importance of Reich's work for Kornergetics. Here's a person who's not very seriously discharging or trying to discharge with his legs up in the air. And you can see the dog is very relaxed. I doubt if Reich had dogs in his sessions. Okay, so John asked me to teach a course. Was already in existence in our training program. There was, or I don't know if it still exists, a course called Foundations or Orientation to Therapy for people just coming into the first year of training. So he was very concerned that they weren't getting enough information about Reich in this course. So on 7/31/1988, he wrote me a letter saying, in the first place, the traditional therapies are not adjunct to Kornergetics. The emphasis, I feel, should be on Reich, who represents the step of transition from psychoanalysis to the body and spirituality. In relationship to what is psychotherapy, I feel that there should be an immediate and strong connection through Reich to the body. The focus should be on the fact that when psychoanalysis threw Reich out of the conference in Luzerne in 1928, they also threw the body out of the psychotherapeutic process. I don't feel it is important to discuss the wide variety of writings by other therapists. The essence of our work comes from the transition of psychoanalysis to the body and the connection it has with spirituality. This is the key to teach Kornergetics to beginners. There should be intense reading and emphasis on the practices of character analysis, bioenergetics, and the connections they have with spirituality. So that, was his feeling as he, began to train, or as he continued to train people in Kornergetics, that they could read about other therapies, but not at the beginning of their training. He really wanted the concentration on Reichian work. So Kornergetics is obviously, well, maybe not obvious to you, but movement energy is a big focus. And it's, as I had said before, it's evolutionary from his thinking. And I'm explaining Kornergetics to you from John's point of view, that it was an evolutionary therapy, body-centered, working with the whole person, body, mind, spirit, and emotion. And the map of personality I have on this slide, it was one he carried around with him wherever he went, actually. And the bottom layer, the blue layer, represents the body because everything happens in the body. And then the red layer is emotion, the lighter yellow mind, will, the darker yellow, and then spirituality. So in John's frame of reference, all these things have to work in an integrated manner. And if you're out of balance in any one, that in itself leads to a difficult life and maybe what you would call neurosis. So too much will or too much emotion. So again, as your energy becomes more balanced and flowing, you would expect a balance in these layers. So he saw Kornergetics as integrating energy and consciousness, restoring healthy energy flow to the body as you break through the blocks in the armor, dealing with stress, negative events, trauma, because otherwise you may get ill. And, he worked with breathing, movement, and consciousness. You have to be aware of what you're doing, and you have to be aware of all the different aspects of yourself if you want to change. And, there was a lot of Reich here supporting emotional authenticity. Reich might not have talked about love, but he talked about softness, so there's this connection always of a softness entering into the personality and the being. So deepening the breathing. So in this work, it's not always done on the mat. Here you have Lynn working with what we call a roller in Kornergetics. And the person puts their back on it, right behind the diaphragm and the thoracic segment, and begins to open the breathing. And then you can roll forward and bring that down into your pelvic segment as your breathing opens. So it's very good work. So Lynn teaches how to work breakthrough armor with the roller. And here you have, over here, Irene helping someone work with their pelvic block, So again, in this case, it's standing up, hitting against it. This is a big foam rubber thing that people use. Pierrakos wrote a book. I don't know if you can see it. I have it here. Show and tell here. Core energetics, developing the capacity to love and heal. And he views the human being holistically as a psychosomatic unity and sees all existence as unified. And theories brought from Reich, brought into Kornergetics, are energy and consciousness, the character structures, body readings to map the energy in the body and assess the defenses, And I don't know if Reich ever talked about aura and chakras. That might just be John Pierrakos, but they did talk about the human energy field. And the map of consciousness, mass, lower self, higher self, which Reich had different words for, and psychosomatic unity, meaning that what happens in your mind happens in your body simultaneously. So there are many of Reich's therapy theories embedded in our work. And I think we're all very proud of that and honored by them. So again, I mean, for how energy flows in the body, and this is a picture of me teaching, I just put a figure 8 over my body. I wish my energy flowed so well, but anyhow, Reich called it orgone, Pierrakos called it life force. But there's streamings that if you're not blocked or overly armored, can move through you in the form of figure 8, crossing at the solar plexus, and then again at the soft palate in your mouth, or hard palate, one of your palates. And that, Reich talks about, I think this is one of the best books ever, Function of the Orgasm. I think he really spells out so much just about energy, even if you're not interested, even if sex is the last thing on your mind. It is an amazing book for the life force for energy. So our energy flow is distorted by the blocks in our body, and our work as facilitators and therapists and practitioners is to open the blocks, release that energy so it can flow back into the body where it's needed, where the organic way it should flow. So in terms of sexuality, it's important to us to work through these blocks, particularly in the middle of the body. And let's see if I have this annotator thing here. Okay. So, to begin to really bring a connection between the heart, pelvis, heart, and even the head. So the bow is a very good exercise for that, stress exercise. And Irene is helping a client with that in that exercise. So Reich and Pierrakos believe the energy must connect to the softness between the softness of the heart, and John would call it love. I think Reich called it softness, with the pelvis, so that the person will be creative, healthy, and successful. In contrast, where sex is mechanical, or you're just using the pelvis, there's no connection to the heart. There's an attempt sexually to control or overpower another person, and it can lead to neurosis. Blocked and dammed up sexual energy creates depression, anxiety, impulsivity, shame, feeling dirty, disease, and addiction such as porn. Health issues can occur, which include diseases like cancer, arthritis, eczema, cardiovascular issues, and so forth. So again, working with the sexual energy, the blocked energy, having a discharge so it flows back into the body where it's most needed is very important. We teach the character structures from the first year and all the way through, and I'm not going to go into them because I think you know them. So So Reich, where am I going here? Okay, so Reich talked about different layers of the person, and these are embedded in John Pierrakos's model of consciousness, is what John called it. So for Reich, he talks and writes about the third layer of the person as the face, what each person wants to present in the world. It's not to the world, not necessarily their truth. So it could be compulsive politeness or compliance. And John called that same layer the mask. So it's again our false self, what we want to present or even don't want to present. You know, it could be something like whining, or a certain like negative thinking. But on the other hand, it's still the mask because it's not down into the deeper truth. And then Reich's second layer is irrational, cruel impulses. And we have that same thing. We call it the lower self, very similar to the id or the shadow. So it's just amazing to me how people renamed a lot of the same stuff, but I guess that's what people do. So here we are dealing with cruelty again, and that's our lower self. And on this layer in our picture, it's this yellow layer. And then Reich's first layer is the spontaneous, truthful human being, the primary layer of man. And we call that the higher self. And again, it's truth, love, authenticity. So this motto is so embedded in core energetics that it's amazing to me that how similar these things are. We work with resistance. That's a very strong part of core energetics, at least the psychotherapy part of it, where you confront the person's mask, you confront the face that they present to the world where they're not in their truth. And we confront it both by just talking to someone in the talk therapy part of the work, but we also confront the mask in the body, which is in the form of blocks or leaks or energy fragmentation. And both Reich and Pierrakos were very concerned about negative transference and really wanted to free the person up to express their anger, even their hatred, rage, if necessary, whatever, toward the therapist, that it should be an accepted part of the practice to help people. So here's a couple examples from Pierrakos confronting the mask. He might say, you talk about pain and your face expression is blank, and you talk about pleasure and you have the same blank expression. Are you aware of this? So again, he's pointing out that the face doesn't change no matter what the person's talking about. Or here's another confrontation. When I start to work with you, you act as if you can't do anything. You say, do it for me, take care of me. You know, that's what you do. Your face says, do it for me. So again, he's always putting the person's stuff right at them, in addition to all the body work that he does. And I think that's, you know, he's was a very powerful facilitator, therapist. I think the psychosomatic identity is fascinating to me because I'm always interested in body stuff. My dissertation was on anger and hypertension, and I did a whole core energetics thing with that. So whatever happens in the mind occurs simultaneously in the body. It's the same for both. And what John Pierrakos said, mind and body, they're all the same. They're all connected. They express at the same time. And biopathy means a disturbance of bioenergetic energy, life energy in one's natural pulsations. And isn't that the truth? Aren't we trying to bring people back to their natural pulsations? And when you have that disturbance, it's in the mind as well, and whether people are conscious of it or not. And so, well, oops, so many things I can't even see what I mean. So body reading. Reich says the body is our frozen history. Let me just check my time. And you can, here's a picture of a person. So what we look at when we do a body reading, although we don't necessarily tell the person this, we're looking at their shape, their size, even their height, or weight, muscular blocks, armor, undercharge, where they're leaking, aura, chakras, facial expression. So we're looking at the energy. Does the energy go up? Does it come down? What's happening? So even in this picture of this lovely person who has a fairly harmonious body, she has a goodwill center, but there's a tiny leak here. You see a kind of a nice curve in the back, but a little bit of a holding in the legs. Actually, probably would fit into more of the masculine aggressive from our standpoint of a person. So there's more holding in the lower body. But, so a body reading is something we teach our students, and it's also a great way when you meet clients or patients to talk to them when they're willing to feel comfortable enough to show their body about some of their issues that may feed into their presenting problems that they're not even aware of. So, pulsations, vibrations, I mean, that's where we're going. We want the energy to flow and discharge vibrations of the total musculature, involuntary contractions, release of dammed up sexual energy. So that's what Reich talked about. That's what we talk about. Every living substance pulsates in the form of energy. Core energetics techniques involve charging the body to break through blocks so as to create a softening, release, and discharge of energy into the life stream. So techniques from Reich, we do work with all 7 segments, but not necessarily in the same way he did. So I took this lovely Greek statue and tried to divide it into 7 segments. But in our work, we may start here with grounding at number 7, and then maybe move up to the throat to release that, so the person's energy could flow more through their body. But we can't work with these segments until the energy can come down from the root chakra. So even though we're not working with sex per se at the beginning, we are working to release some blockage there. So these are just pictures of people working, whoops, sorry about that, with the segments. This person leaning against the wall is, again, bringing energy down into the pelvic segment. Here are people, opening up the chest area and the diaphragm, just in simple, fun, I don't know if they're fun, maybe not fun is the wrong word, but exercises that, so we use a lot of different ways, not just mattress work. Breathing. Many people experience shallow breathing and it deprives them of their vital energy. Deep breathing releases feelings. Both Reich and Pierrakos stress breathing fully. involving the abdomen, solar plexus, and chest, all the segments. Reich was known to say, breathe out through the genitals. Pierrakos shaped staccato breathing similar to one of Reich's breathing techniques, but he thinks it was different. He felt that Reich's breathing involved a lot of mouth breathing, where in the in-breath in our staccato breathing is through the nose. So it would be all nose at the beginning. So that, and according to him, then the energy goes up to the brain and stimulates it. I don't know if that really happens, but that's the theory. So he designed staccato breathing after seeing infants nurse at their mother's chest. He saw the babies kind of sniffing through their nose while they nursed. And so that led to his in-breath as being these little sniffs and then a big exhale out on this, and then a release. So in through the nose, there's 3 phases: breathe in, expansion of the chest, breathe out, contraction of the belly, and then a rest for integration before the next breath. And again, here's Lynn teaching that breath, and we can do it. You can do that breath lying down on a mattress, but you can also do it here on the roller. And again, like some of Reich's other techniques, here you have Lynn, not the person's breathing, but Lynn's pressing on their body. So we have things like deep breathing and kicking, breathing and eye movement together, similar to what Reich did. Massage deeply, as she's doing here, into the chest of this person, working with facial expressions, using stress positions to trigger involuntary streaming. Gag reflex, we incorporate that into our work. And any bioenergetic movements, kicking, punching, stamping, jumping, shaking all over. So a lot of the techniques are in our work. And, we try to develop some original ones as well. So both Reich and Pierrakos were fascinated with, how do I say this? With energy beyond the human body. And this is a picture of a hand that's touching, I don't know if you can see it. Here's a hand, and here's a hand touching an orgone box. So you can see the difference in them. And they both studied this energy, and it's just fascinating. Many names have been given to the mysterious energetic force associated with vitality and life. Originally, this force was studied in relation to the human body, as in prana or chi of ancient Chinese medicine. Reich expanded it to include universal life energy that extended beyond the organism. He believed that living matter tended to radiate energy, an idea based on his observations of clinical patients releasing powerful waves of energetic discharge as they experienced intense emotional breakthroughs. Reich confirmed his initial observations with the use of specially modified electric meters, which, when attached to the body with electrode sensors, detected a subtle bioelectric charge. So Pierrakos was very involved in that work. And when I met him, and I still think I told you it was 1983, he had a laboratory in his office on the 12th floor at the building in 23rd Street that was just a laboratory, not for client, patients, or anything, with all kinds of machinery and stuff to measure this energy. And, he often talked about it as an aura, and I don't know if Reich used that term, but nevertheless, there was a scientific aspect to both gentlemen. well, particularly to Reich, but there was one in Pierrakos as well. So this was John's orgone box, and I've had it at my office for a while, and now, and it was from his laboratory in 23rd Street. And now I'm getting ready to donate it, or we as Bioenergetics are donating it to the Psychology Museum at the University of Akron in Ohio. So how their approaches differed. So as I said already, the segments were treated differently. The pelvis is not left for last, where Reich said, don't touch the pelvis, as if something terrible would happen. John said, as soon as you ground the person, you need to work with the pelvis to ground the person. And once the person's grounded, it's no problem to work with the pelvis. Secondly, Pierrakos says his core in Bioenergetics is different from how Reich used the word core. By core, John means the heart. If you want to touch your heart chakra, that's what he means. Because he sees it as the most spiritual chakra of any. By core, Reich meant cosmic orgone engineering. I don't even know exactly what cosmic orgone engineering means, but that's was how he used got core. On the topic of spirituality, they obviously differed. John said if someone spoke of spirituality in front of Reich, he thought there was something wrong with them. And he called it a character problem, and he was contemptuous and negative. He didn't separate mysticism from spirituality, and he saw the whole thing as anti-scientific. I don't know where I saw this, but supposedly he dismissed Jung in 1 or 2 paragraphs in his book, Character Analysis. Reich, again, this is according to John, it may not be correct, but it's what he thought. Reich did not ground his patients, so they would sometimes flood or split. In Bioenergetics, probably in Bioenergetics too, grounding is always worked with first, so that the energy has a path when it releases. Finally, for Reich, the orgasm reflex was the main goal. And in Bioenergetics, it's also true that it's a goal, but even more so, John emphasized the union between the heart and the pelvis. So that his idea was very important, the heart and the pelvis being connected and integrated. I put this picture here because you see a person with a pendulum measuring the heart chakra. I don't think, and again, that would be more of a focus that would come from Bioenergetics rather than Reichian therapy, I believe. So I have this wonderful video of John working, but I couldn't get it to work on my computer. But I took a little, I tried to do it with my phone to just give you 2 or 3 minutes. So I don't know if this is going to work. I'm going to stop my share for a minute, try to bring up my phone so you can see this little thing. And I'm going to stop my share, bring up my phone, start a share again, and have you see 2 or 3 minutes. John's working, in this case, if we can see it, with a client who has passed away, but he was a student, and this was a demonstration video for students, so I feel ethically that it's okay to share. So I'm going to stop for a minute, and okay, so I want to say hi to everybody again. Okay, nice to see you. And screen share, let me see if okay, I don't know if this is going to work, but I'm going to try. This is just 3 minutes of a half an hour thing.
Sometimes. What do you usually feel? Let's say you feel heavy, or you feel, how do you feel?
Heavy, weighted down, numbed, manipulative, that kind of stuff. Not in touch with deeper stuff.
Are you, you mentioned something last time about special, situation of your work. It's going on the same way?
I don't like it very much. I don't like them, and
I tell you, I'm taking some courses at the APA.
They're both doctors, so that's why he's talking like that. Okay, so that's all I gave you of that. So I wish you could see the whole thing. I wish I had a way of getting the whole thing onto my computer so you could see it, but I couldn't. So I'm just going to go back to sharing some more and talk for another few minutes, and then we can move into questions, or I don't know that you'd have any questions about this, but if you want to share anything, I can learn from you, I'm sure. There's a lot here to learn. Okay.
Let's see.
Now I can't find the view.
I don't see any hands online yet. Anyone here?
Well, we're not sharing yet. I mean, I'm still speaking.
Oh, I'm sorry.
Yeah. Well, I'm looking for. I can't find the thing that shows. Well, this. What am I looking for? View. Where's the view thing? Well, okay. So you can see from the screen, I would imagine. No, it went all the way back. Here we go. Okay. Let me just stop the share again. How are we doing here? Is this or is this okay? Should I go on a little bit?
Oh, we have plenty of time.
Okay. I just don't know if it's boring people, if I can't tell if my audience is alive, interested, or what's going on. But.
Okay, they're very enthusiastic.
Love it. Yes, keep going.
Okay, thank you. That's It's nice knowing there are people out there, let me tell you. Mm. Okay, so this is another example of, this is a client that I was working with. I was trying to write an article, I guess, about something that actually, this is the book, I don't have time. It's called Beyond Talk Therapy, Using Movement and Expressive Techniques in Clinical Practice. So I was trying to write an article about core energetics for this book. So I use this example of Nora. And so this is just another way to look at our work. So she had inability making contact for same-sex relationships. She's a small woman in her early 40s, slender build. She had a few acquaintances. She was a mother and a wife, but she didn't have any close relationships, particularly with other women. And on a diagnostic level, she showed symptoms of what here we call in the States dysthymic disorder, which is a form of depression, low energy level, low self-esteem, some hopelessness. It had been going on for over 2 years. And according to her family history, she received very little warmth as a child, very little physical affection from her mother. Her father was a manager of a department store, and so he was never around. It was a lot of hours in those days. And the mother was always, as she described it, going out the door. So her body showed she had a long, narrow face, a tense, inflectable jaw, narrow, tight, flat chest, and a diaphragm so constricted it looked like she wore a muscular girdle. So, and it suggested very little nurturance during the oral period. Her taut shoulder girdle didn't allow her shoulders to relax, drop down, move forward or backward. I can't imagine that she could have reached out or even expressed aggression, said, get away. However, if you looked at her body, she had this kind of lovely pelvis. So there had to be some connection either to the father or a brother or somebody. A well-developed, movable pelvis and shapely, somewhat muscular, but shapely legs and feet. And her back kind of expressed a strong rigidity, not necessarily of the rigid, but someone maybe who was a little bit compulsive. But nevertheless, you could see that there was enough rigidity in her structure that she could achieve and be successful to some degree. She had blocks in her throat and jaw, and it made it difficult for her to speak her truth, probably also to receive love from other people. So that's kind of a description of Nora. So because I was writing for this book, I needed to give a demonstration in writing of what core energetics look like. It's just not easy to do. So I used staccato breathing as my method. And I said that inhalation and exhalation were diminished due to a strong contraction from the chest all the way down to the diaphragm, and protecting her from experienced heartbreak, separating the warm feelings in her pelvis from the rest of the body. So she had something in her pelvis, but that energy couldn't get up because she was so tight on the top. Solar plexus chakra, which in our work indicates self or a life path, showed that she didn't feel welcomed on the planet. So she chose to live, but she took up very little room in her family and on the planet. She really contracted as much as possible. Let me move this a minute. Water. So first I built rapport with her and did the interview and body analysis, and then introduced her to the staccato breathing that I talked to you about before, breathing in through the nose. And as you do, you're kind of expanding and then exhaling out and contracting on the exhale, and then waiting till things integrate before your next breath. So that's the breathing that she was instructed to do. And once she began to do this breathing, she had difficulty. Our pictures are blocking my screen. So she began to cough. Her chest couldn't take in additional air. She said it feels too tight. She felt like she was suffocating. Choking and coughing continued in the next 3 or 4 sessions until the muscles began to relax. When her breathing became easier, her upper chest appeared more energized. Her self-esteem began to rise. And since energy flow and fatigue and low energy that characterize depression are mutually exclusive, as she got more energy, the depressive symptoms began to diminish. Sucking air through the nose, Pierrakos' version, inhaling in short bursts, allows oxygen to go directly to the brain, thereby helping organize the mental processes in the ego. He wrote that in 1997. You may or may not agree. The inhalation also mobilizes several segments of the body at once, as the pelvis, abdomen, diaphragm, and chest, come together in these little breathings, where if you take one long breath, you don't get that same sense of integration. So then after you do the staccato breathing for a while, you can add to it. So you could actually have people breathe and hit out or kick, things like this. So you can bring the breathing and connect it with what they need. Maybe they need eye contact, and you would stand with them and look at them while they do this breathing, whatever it is they would need. In her case, opening the throat seemed important. So in this case, I don't know if you can see me, but you would take the breath in, and then on the out breath, you massage it, and kind of open up the area that's blocked. So for her, it was important for her to, because she needed to communicate. You're not going to make friends if you can't talk to them. And she needed to be able to tell people what she wanted and ask for what she needed. So to open this block became important. So we had her breathe in and on the out breath, and at the same time stamp her feet so that she could ground this energy. So that's kind of some of the work, that you can take this breathing and add other elements to it, is what I'm trying to get across. And then just here's people in a core class working with their hamstring and discharge and so forth. So I'll say something quickly about the core energetic curriculum and begin to bring this to a close. Year one, this is in general, we have programs all over the world, so they, each administrator can change the program. And although we do have one basic curriculum, people should be picking and choosing from, but there's introduction to character structures, a foundation, and which would include Reich and his history, teaching about energy and consciousness, and then the map of consciousness, what Reich talked about as the face and the second layer, and the primary layer are higher self, lower self, and mask self. In year 2, we have a emphasis on techniques. So here you have a person kind of pounding, and here's another person. These are people bringing out aggression, charge and discharge activities, grounding, aura work. So there's soft work taught, and then the roller work, segmental armoring, diagnosis and assessment. So that would be year 2. Year 3, we have 4 stages of therapy. Confronting the mask, which I talked about earlier, bringing out the lower self, and raising the energy level, raising to a higher vibration to the higher self, and then finding the life path. We work with sexuality. We work with linking techniques to the different character structures. We work with resistance, body reading. We work very strongly with transference and countertransference. We teach people how to do an initial interview, treatment planning, and a termination interview. And then year 4, I call it leadership, but it brings a lot of this stuff together. So you'd have advanced sexuality, advanced transference and countertransference, and then you add in things like group process, psychosomatics, couples and family, and then some pathwork stuff, reason, will, and emotion, pride, self-will, and fear, practice sessions. And then after the 4-year training, people get a certificate, but often people go on, if they want to teach or be involved in our trainings as assistants or eventually faculty, they need to at least do a 5th year. Meanwhile, I want to say that ethics is taught throughout the training. In other words, if you don't, year 1, 2, 3, and 4, because I don't know how it is in Europe or other countries, but here, this is really, ethics is very important. People are always suing each other anyhow. So it's important to really know what your boundaries are and respect them, everything from confidentiality to use of touch in therapy. So we have a 5th year for people who eventually want to teach, and which culminates in the final project. And they're usually wonderful projects. They all have research components, and they're extremely well done. And the coursework in that 5th year, again, involves psychosomatics, sexuality, as in terms of sexual economy, couples and family, group process, life path. And here you see John, another picture of him, which I like for some reason. It was taken in the south of France, and I was there, and he was planning his lecture. We ask our students to read, and a lot of their readings are Reichian based: character analysis, function of the organism, the man who dreamed of tomorrow. And while I'm saying that, in fact, I'll quote at the end something that John wrote. He wrote the introduction to that book, I think, or one just like it. Maybe not that book, but one just like it. Fury on Earth, History of Wilhelm Reich. I love those early histories of Reich, talking about his own life. So all these things, and I think because of my interest in psychosomatics, The Cancer Biopathy, I think, is a great book. Patient safety. So contraindications. When don't you do this work? When don't you engage with the body? For us, it would be if there's a psychotic break, if the person has a psychosis, if they're having delusions, if they're overly flooded, if someone comes in and they're totally flooded in the middle of a huge panic attack, if they're ungrounded, if there's a disability that you haven't found a way to work with that person, if they have some kind of health problem. I mean, this work can help with a lot of health problems, but you have to really be careful and have a good analysis of what the situation is, and maybe even do teamwork with some of their physicians. If the person doesn't like the approach, if they don't want to do body work. So we don't, you wouldn't want to force anyone to do this treatment approach. Also for patient safety, it's important to conduct an in-depth initial interview in the work, to have them wear appropriate clothing that they're comfortable in. And, you know, I don't know what Reich's patients work with. When I first came into the field, people were working in underwear. We don't do that any longer. We now wear either a two-piece bathing suit or shorts and a workout bra, something that there. So again, it goes back to ethics and just stuff that's happening here in the States. We do body reading so that we understand some of the issues that go along with the presenting problem, but only when the client's ready, not forcing them to do it. Some people have counseling contracts with a full disclosure of method and technique. And then the word stop. If the client says no, we're to respect that. So those are some of the things we do for client safety. So this was, I took this statement and it's a little bit negative, and I don't know why I did that, but I guess it's just my personality. Anyhow, John wrote this in the foreword to a book by Edward Mann, and the book's called Vital Energy and Health, Dr. Wilhelm Reich's Revolutionary Discoveries and Supporting Evidence. And it was published in 1980 in Toronto. Yeah. So this is kind of negative, but I think it also shows John's kind of his own conflict, being pulled toward Reich and away from him at the same time. So he said, and this is like a 3 or 4 page forward, but this one little paragraph. In my contact with him, I perceived him as being soft and warm on one side, but on the other, very quick to anger and violent reactions. His personality under adverse conditions was characterized by sadness and hurt, and the feeling that he was a misunderstood genius. He felt lonely and was isolated, but inside was soft and yielding. The outer shell presented a picture at times of a hard shell and arrogance. He himself wrote that he never lost his armor. Reich despised sentimentality. He acted as though he was separate and above, and thus he alienated many important people interested in his work. So I think that shows some of John's ambivalence. I mean, I think he loved him and he took a lot from him, but there was this kind of ambivalence there as well. Here's a picture of Reich. It might even be where you all are right now. I don't know the room, I haven't been there, but and then this last slide is just me, in case there's any reason to contact me. That's my phone number, and that's my email. So, yeah, I'm going to stop the share, and thank you all for listening to me. And I guess open it up for comments or whatever.
Hi, thank you very much, Karen. This is, I don't know if I'm on the video thing or, okay. My name is Renata. I'm Wilhelm Reich's granddaughter, and really happy to have you with us today on our conference. Thank you. my mother was Eva Reich. And so she was, of course, in touch with all these people like John and, many, it's just, but I was young. And of course, just names in my memory. I have a question though. I work as a nurse midwife and I have, I'm not a therapist myself, but I grew up with that milieu. But the man in the patient person in the therapy, from a Reichian perspective, I looked at him and I thought, oh my God, he's possibly re-experiencing a circumcision. I mean, maybe just his position that he was in and the screaming that he was doing. But
Right.
so I know you said that you don't necessarily go backwards as much. It's more sort of forward. But is there some component of the work, of course, that brings up older traumas?
That's all we do, really. So if I gave that misunderstanding, I'm totally, this is not counseling. This is why
Sure.
transfer and counter transfer are so strong. In fact, I've been giving lectures recently on the wounded wound, going back all the way into the womb.
That's great. That's what I sort of thought, but then I didn't know if I was understanding when you'd mentioned when you stand up, you're going forward kind of.
Well, it's just, that's because I think that I can't speak for Lowen, but for Pierrakos, I think he got tired of patients who were always saying, do it for me, do it for me. He wanted people to take responsibility for their life.
Yes.
But yes, we go back and work through every wound there is, and we will start with conception if we need to.
Wonderful. Thank you. And there may be more questions here in the room. So, and some of them might be in Spanish, which will need translation for you and so forth. So we'll work on that.
Okay. And I also invite any of my colleagues that are here. I don't, have all the answers. I know Myrna's here and I don't know who else is here. Judy Gottlieb's here. I see her name. So anyone here can answer the questions. It doesn't have to be me.
Hi, my name is Jim Strick. I'm curious to know the idea of grounding that you mentioned more than once, and that we heard also from Lowen's son yesterday, that grounding is very important in terms of how you conceive of the energy moving in the patient's body. I wonder if you could say some more about that. It's not something that Reich ever talked about. And in his understanding of orgone energy, it's not like electromagnetic energy where you'd need some, to ground a source of energy. So I wonder if you know how Pierrakos or Lowen came to that idea, whether they had some kind of laboratory evidence for it or exactly how it first came about.
Well, I will answer. I'll answer some piece of that, and then I'm going to ask my colleagues because I don't know how it first came about. But I will say, for grounding, what Pierrakos meant energetically was the figure 8 in the body. That energy comes up, crosses the solar plexus, goes up to the mouth, and then comes all the way back down, so that you have millions of streams of energy flowing through your body. And if that's not flowing, you're not grounded. How they came about it and all the stuff you're asking, which is fascinating, I don't know. We have other terms, like grounding can mean like being in the present, being in contact, but they still see it. From what I was taught, it was still seen in terms of Reichian energy that you have to have that flow throughout the organism. But Myrna, do you want to answer that, or Judy, or anyone else? I don't. Anyone have a better answer than me? You're welcome to give it. I'm sorry, I don't know more about it.
Hi, this is Frederick Lowen. I just heard the question. I'd be glad to give you my understanding of it. Can you hear me all right?
Yes, that's fantastic. And I would love to hear your understanding of it.
Sure. Basically, it was really an observational thing. I asked my father how he came up with that. And he indicated that he simply observed that people who had a sense of well-being and standing their legs really exhibited some healthy characteristics that Dad really began to understand was an important aspect of well-being, basically. So it was very much an observational thing of people.
Okay, cool. Thank you.
Yeah.
Great. Anyone else want to add to that? Okay. I thank you.
We have a question in Spanish.
Mhm. Okay.
Hola, mi nombre es Socorro Molina. Y así como ha hablado ahorita de la diferencia entre la técnica de Reich y la de Pierrakos, ¿qué diferencia hay entre la técnica de Core Energetic y bioenergética? Ya que los creadores compartieron conocimiento. Gracias.
I didn't totally understand the question. Difference between core energetics and energetics. I don't know what energetics.
Bioenergetics.
Bioenergetic. I don't know. Well, I'll give you my thing, and then since Frederick Lowen's here, he can give his. But what I understand is the spirituality part, where John really wanted to introduce the higher self, the lower self, and the mask as a spiritual dimension of a person, not just the way Reich talked about it. And he had gotten involved with Eva Brock at the time, and there were all these pathwork lectures. And I think, that was a breaking point. And then I don't think in core, even though we use all the Reichian work, we're still very strong in terms of heart, like, seeing the person's higher self, seeing who they truly are on a soul level. And we're not always so strong on technique. Technique is not the overriding factor. We teach all the techniques, but we really want the relationship to be the most meaningful thing. So I would say that and how John looked at it, and he may be wrong in some ways because he had his own prejudices, was that bioenergetics was more mechanical on a certain level. And it may be stricter in terms of technique. So that's my answer, but there are other core people here, and I'd be interested in Lowen's interpretation. Anyone else want to say something about it?
Sure, I'd be glad to say a little more.
Okay.
And I think you're very much right. I think that the real difference was the spirituality thing. I think when John got together with Eva, for whatever reason, it created a bit of a split professionally and even personally between John, my father. But they maintained good relations throughout. But I know that my father really, as you indicated in your earlier slide, he wasn't anti-spiritual at all.
Right.
I feel like, in the bioenergetic community, at least my own take is that spirituality is not something you wear on your sleeve.
Mm-hmm.
And in my own belief, as I was talking about the mind-body split yesterday, I think when mind and body are disconnected, spirituality is the victim. And as you approach a better connection between how we think and how we feel, then spirituality reemerges, because it is something I think that we're all born with in a sense. But the only other difference I would tend to point out is that as core energetics developed, it opened its training to everybody who was interested.
Mm-hmm.
Versus the bioenergetics, even today, limits trainees to credentialed practicing or studying psychotherapists. And I wouldn't use the word more mechanical to describe bioenergetics versus core energetics. But I do think that the framework, the conceptual framework that was built upon Freud and Reich's work is really unique to the bioenergetics. You know, certainly core energetics uses a lot of the characterology, but I'm proud of the fact that my dad really did a lot of the heavy lifting after Reich's work on it, and really brought it to a fairly complete framework. And so I think bioenergetics tends to adhere to that somewhat more, in my sense, than core energetics. But, you know, not a lot of difference in the approach, techniques, and thinking.
Yeah. Yeah.
Aside from that, right?
Yeah. Right on.
Yeah. So I'll let you finish here.
Thanks for your take on that.
Well,
Yeah.
thanks for your time today.
Yeah. Okay. Anyone else want to answer that question?
There's one online comment that's been sitting. Would you comment more on the nature of confrontation in individual and group sessions, as well as projection?
Yeah.
Will
Who's
Freeman.
asking that? I can't see.
Will Freeman. Well, David as moderator. It's from the chat.
Okay. So the question was, would I comment on confrontation? Is that what you're saying?
Nature of confrontation and projection in individual and group sessions. If you have any
That's
response.
a big question, obviously. Well, it happens in individual. I mean, there's no therapy without confrontation. To be honest with you, I mean, we're all very egocentric, right? We like what we present, so, or we think it's who we are. So until you confront what people are doing on some level and help them see themselves how they're coming across, or even what they're, you know, the smile when someone's talking about something sad, or even confronting stuff in the body, you know, how you hold your shoulders. If I have my shoulders like this and somebody doesn't ask me to change them, you know, I'm going to keep them up like this. I mean, I'll live in fear. I won't know. So I think confrontation runs through the whole gamut. At least of my work as a psychologist, and you know, but I may not be understanding the question because it was in the chat, and but it is. To me, there's no therapy, group or individual, without confrontation. But help me, other people chime in. Yes, Peter, do you want to say something?
You need to unmute yourself.
Really great to see you again, Karyne. I wanted to comment on the difference of grounding and maybe the difference between core energetics and then what seemed to me to be more of the stream through the American College of Orgonomy or Institute of Orgonomic Science, because I did the 5 years of the core, and in fact, I remember you coming, I think, for couples work, Karyne, and that was, I still remember you as my favorite teacher, actually.
Oh,
and I think your softness and contactfulness really comes through in your sense of humor. So I really appreciated that. What core energetics did was help me develop the will. I was very much an oral character. Sigmar Gerken said I came in with sticks for legs. And it was daily bashing and rage work that finally got me into a position where I could build a private practice, and I remodeled an office, and I'm still working in that same office since 1995. Then through a series of synchronous, I somehow came across more of a stream. And in a way, you could say from Baker's diagnostic typology, I was not really an oral structure. I was really more schizophrenic or schizoid. And with working with sorry, there's an alarm going off for some reason. Excuse me. I was able to come out of profound lifelong dissociation that I didn't even know I had. So it was no longer a question of remembering to breathe. There were many more spontaneous feelings that emerged, and I was able to become much more functional in my work life, etc. So there was a very big difference. So that would be like contact from the ocular segment, the brain segment, that was really missing. I remember Pierrakos and Sigmar too. They didn't really emphasize working much with the eyes. So it was very different with 8 years of therapy with Blasban, and then continuing with Dr. Schwartzman, and now with Hugh Brenner, still trying to work with all of the dissociation and the terror and the fear that was in my body. And so the will was very helpful for me. And somehow I came to a kind of a different understanding, and the integration between character structure and how the body worked. That was sort of a revelation to me. So those are my comments.
Great. Well, sounds like a wonderful journey. With some closure even. Good. Anyone else? Questions, comments, or I don't know if anybody's in the chat, or Myrna. Yes, Myrna, come talk.
Bueno, yo necesito traducción. ¿Es posible?
La tienes, Mirna. La tienes, Mirna.
Bueno, yo vivo en México y tuve la fortuna de conocer a John Pierrakos y trabajar desde el primer módulo muy profundamente. Y yo estaba en ese primer módulo en una gran depresión y sentía un hoyo aquí en mi pecho. Y bueno, John Pierrakos hizo un ejercicio que hacemos en CORE, que es pues que la persona se puede sentar un momento en la silla de la máscara y ver qué es esto que conecta, ¿sí? Desde la máscara, que puede reconocer de lo que trata de aparentar ante el mundo, y al mismo tiempo pues poder observar el tipo de coraza y las resistencias que tiene para conectarse con los demás, y después pasar a la silla del ser inferior y poder ver todos estos sentimientos reprimidos, negativos, autodestructivos quizás, y destructivos hacia sí mismos, hacia los otros, y poder ver el nivel de conciencia que tengo de esto, que yo vivo pues en esta cotidianidad y que me crea tanto conflicto. Y luego pasar al ser superior para tratar de reconocer estos aspectos positivos que a mí me permiten sentirme más abierta a la comunicación con los demás, con más confianza en mí y en la vida. Y cuando John Pierrakos, cuando yo pasé a la máscara, dijo, no estás en la máscara. Me dijo, no estás en el ser inferior. Y me dijo, no, tú estás en el ser superior. La razón por la que John dijo esto es porque yo había podido nombrar y reconocer esos otros dos aspectos, pero para mí fue muy fuerte cuando él me dijo que estaba en el ser superior, porque en mi vida había sido muy difícil asumirme como una persona buena desde adentro. Habiendo tenido sentimientos negativos tan fuertes hacia mi madre, pues aparentaba ser muy buena hacia afuera, pero yo internamente no creía que hubiera algo bueno en mi interior. Así que aparecieron todas mis resistencias a ello, y John hizo un trabajo en la cama, pues con la respiración, y esta respiración me fue llevando a hacer movimientos corporales y finalmente abrir mi garganta y sacar entre dolor y rabia Y bueno, pues esto fue muy, muy profundo, los gritos eran muy, muy intensos y yo sentía que venían desde mis genitales, mi panza, mi pecho, mi garganta y mi cuerpo pues finalmente se iba liberando. Yo tenía los ojos cerrados. Cuando abrí los ojos, vi los ojos de John, en donde tenía lágrimas, y yo sentí que por primera vez un hombre lloraba por mí. Sus ojos azules y sus lágrimas, su expresión pues de amor, de ternura y de confianza. Sentí que volvían a ser. Lo que, al describir esto, lo que les quiero decir es que cuando yo salgo de este lugar, ¿sí? Es como haber regresado a mí, ¿sí? A mi encarnación, a saber que tenía un lugar en este mundo y que entonces esto le dio sentido a mi vida. No era encontrar como una misión en especial de tienes que hacer esto en la vida, sino que la misión de vivir era suficiente, que era bueno vivir, pues, que mi presencia en este mundo tenía un sentido. Y bueno, a partir de esto es lo que quiero compartir y que John Pierrakos siempre nos enseñó.
We are at the, I'm sorry to interrupt, but we have to, please be brief because we're at the end of the session.
Okay. Okay, so let me say thank you to Myrna. And I know Judy Gottlieb wanted to say something too. Do you want to come in, Judy, quickly?
We don't really have time unless it's just a very quick comment.
A very quick comment, Judy.
I just want to thank you for your really clear, concise presentation of core energetics. It's really beautiful, Karyne.
Thank you so much. Thank you. I think we're thanks, Judy. And I think we're being told to end. Myrna, I'm sorry that you didn't get to finish what you were saying. Do you have something you want to say really quickly? No. Okay, so do I just leave the meeting or what happens now?
Well, we're going to stretch our legs and get ready for the next session in 8 minutes.
Okay.
And we want to thank you.
All right.
Thank you, Karyne.
Hey.
Yay, I'm glad I was here.
Gracias, Karyne. Gracias, maestra.
Thank you all. Okay, bye. Have a good break.
I know, we need